Eno ye Salam TV.
Webali nti otwegaseeko eno breakfast meeting elunaku olwaleero era tukomyewo ne Dr. Jacob Motyaba okuva mu Rennaisance Wellness Center, banaffe abatukolera abatudaabiriza ebyobulamu. Omuntu lwasemayo okubeera wano naye twayogera ku nsonga nnyingi era n'olwaleero njagala tubeere nga tutandikira. Sebo, you are most welcome to this program.
Thank you.
Yes. Weyanjula eri abantu abo bakutegeere.
My name is Jacob Motyaba, a homeopathic practitioner from Rennaisance Wellness Services. We are located at Matters Crescent Road, Ntinda, opposite UHMG complex. We are a renowned hub for wellness services. We offer colon hydrotherapy, we offer earwax cannulating, we are offering homeopathic services or homeopathic medication. We are offering clinical massage therapy. It's not just any kind of massage, it's very clinical. We are offering services like yoni steaming. We have a new set of therapy that is called the PEMF.
PEMF. What's this?
It's an abbreviation of Pulse Electromagnetic Frequency Therapy.
Pulse
Electromagnetic Frequency Therapy.
Wow.
Yes. So to very many people of us, we are exposed to all kinds of radiations from phones, from the internet, from the telecommunication masts. Being the fact that we are in a modern world, there is no way we can do away with such radiations. And then our bodies are always absorbing in these. But then some of them are at different wavelengths, they are at different frequencies that can actually be harmful to the body. So now how the pulse electromagnetic frequency mat is going to help you, it induces health magnetic waves, electromagnetic waves in the body itself, such that you can reversely emit these other radiations that you've been absorbing in. For example,
Well, what are the effects of those
now
radiations?
I'll give you an example. If someone sits in front of a computer for quite some time, at the end of the day you're going to realize that you'll have eye strain, for example. This is because you're focusing on these very tiny letters or images, therefore you're going to have eye strain. But away from that eye strain, by the time you get off this computer, you're going to realize that your face is kind of dry and taut. Now, this is the effect of the radiation. Yes. Now, to all of us who are, many of us are always using phones. Many of us, 24/7, be it for work, be it for relaxation, for any of the services. So, the PEMF mat is going to help you induce electromagnetic waves within your own body, and these are going to help you reverse the other absorptions that you've been taking in from all these services, from the Wi-Fi's, from the telecommunication masts, from the TV sets, from your phones, and all electronic devices around us. Not forgetting the foods that we are always eating from microwaves. Yes.
What could be the last effect of all these radiations?
Now, the biggest effect,
The biggest effect.
which is actually very prevalent today, are the mutations that are causing cancers everywhere. Because many of us are looking at breast cancers, we are looking at cervical cancers, we are looking at skin cancer, throat cancer, eye cancer, cancer everywhere. But do we actually know where these cancers are? Because cancer is not a disease. Cancer is just an adaptation of the body. It is a mutation, and a mutation is an adaptation of the cells. You get? Now, when these cells mutate and they start multiplying, they become part of the body. And the difference with cancer cells and normal cells, cancer cells grow faster than normal cells. That is why many times you're going to go to the hospital, you're diagnosed maybe with breast cancer, 2 or 3 years later, you're having metastatic cancer. Now, this is metastatic cancer means the cancer has developed and moved from that localized area where it was maybe in the breast and now it's affecting your liver, it's affecting maybe your reproductive organs. For the men, many of us are hearing of prostate cancer, prostate cancer, prostate cancer. Prostate cancer is non-communicable. You don't pick it from the toilet or from anywhere. The lifestyle we are living, there are very many, today we are having laptops. Someone puts a laptop on their laps, just like the name it is, but then this laptop is emitting radiations, and you're directly absorbing them because your groin is the nearest area to the laps. In the long run, it is your prostate that you are killing. So when we hear of prostate cancers, when we hear of prostate enlargements, before we even run to how we can treat it, how can we avoid it, is the greatest.
So you're saying prostate is part of how we live, what we consume, what we...
For example, if I may take you right away from where we start, many people who are getting prostate cancers are starting with prostate BPH. BPH is benign hyperplasia. Now, because of this hyperplasia is going to be just an increased number of the cells, but it is not cancerous. It's not malignant, so it's called benign. In the long run, when you do not attend to this, it's going to become malignant, therefore becoming cancerous. So at Rennaisance Wellness Services, we are saying before you even start going for the dialysis, before you even start going for the very many tablets of the management of diabetes, all that, come back and let's have a conversation about, one, your diet. Let's have a conversation about your resting period. For how long do you sleep? Many of us are entering bed at midnight, we are getting out at 3 a.m. Some of us are entering at 5 a.m., we are getting out at 6 a.m. But then, the body is not rejuvenating enough. It's not getting enough resting period. It's not getting time to refactorize. You get. Many of us who use machines, many times when it gets a fault, the first thing you are told to do a refactorization, or do a reset, or do a restart. This is what we are talking about when we are inviting people for colon hydrotherapy.
Then, Dr. Mtyaba, you're telling me if somebody is diagnosed with cancer, it is not all about doing chemo. You need to go back to see what what you eat and...
Exactly, because let's, for example, look at colon hydrotherapy. Colon hydrotherapy, we talked about it last time as a cleansing of the colon, where we are using plain water. We are not using any other medicines or what. It's just plain water. It's helping us clean excess dirt. By that, very many people confuse colon hydrotherapy with detoxing. Detoxing, as the name, it is a removal of excess toxins. But then not all that is toxin. Undigested particles of food are also that in your colon. Delayed stool in your colon is also that. Excess gas that is giving us bloating day and night is also that in the stomach, because it's unwanted in this region. Now, when we are keeping all this dirt for a long period of time, you come to realize that at the end of the day, you're going to get complications like ulcerative colitis. You're going to start getting a leaky gas, because if your gut is malfunctioning, at the end of the day, you're not going to get what we call proper assimilation of food nutrients. So if the food nutrients are not absorbed in the body, you're not going to get the benefits of these nutrients. That means the cells are not going to be replenished. You start getting constipation because the colon cannot push effectively the stool out of the body. Now, you start doing laxatives, you start doing suppositories, you start doing enemas, but we need to do a reset in the first place. And that is why we are doing a colon hydro cleansing, because through this cleansing, we are extensively doing a wash out in the whole colon. So after us removing all these wastes, talk about the gas, talk about the undigested particles of food, talk about the toxins, talk about the growing bacteria, the growing fungi and candida, we are giving room to the colon to rejuvenate, do a washout of that, let the colon rejuvenate, let the cells be replenished and refactorized, such that the normal functioning of the colon can resume.
Dr. Mtiawa, what else do you do at Wellness?
Now, at Rennaisance Wellness Services, we also have clinical massage therapy. Clinical massage therapy differs from these other forms of massage that we get in spas. It being clinical means, one, it uses classified or special techniques, and two, it uses special knowledge. We of course going to look at the anatomy and the physiology of the body. If someone is coming with rheumatic pains, we are not necessarily going to massage their back. You know, we have to take back a step and say, okay, when are these pains coming in? Because someone might be having rheumatic pains as a result of over exertion. In the long run, you start getting the rheumatic pains. Someone might be getting these rheumatic pains as a problem of autoimmune complications. So we go and tell this person, you know, we are going to do this as a management, but then we have a greater thing to address. So that is what clinical massage briefly is about. And then we also have other services like homeopathic medication. Homeopathic medication. Homeopathic medication is derived from the school of medicine called homeopathy. Now, homeopathy is a form of alternative medicine, like the very many forms of alternative medicine, like Ayurvedic medicine, acupuncture, things like grounding, and very many forms of alternative medicine. It's broad in its nature, that it addresses both acute complications, talk of flu, headaches, stomach aches, stomach upsets, knee injury, elbow injury, or any kind of muscular injury. It addresses that. And in the long run, in case you've not attended to these complications and you start getting other problems like diabetes, maybe due to prolonged use of drugs, you start getting hypertension, you're having nephropathy, you're having retinopathy, your eyes are not functioning, homeopathy is still going to be able to take care of all those chronic complications. Of course, in conjunction with other therapies, because in medicine, or in the fight to see that we are reviving the health status of someone, we are not going to be autonomous and say, this is the only thing you have to do. No, we can do a combination of therapies. For example, if you come at Rennaisance Wellness Services and you're having constipation, you could be having constipation as a result of what you're eating. But then you could also be having constipation as a neurological problem, because your vagal nerve maybe is not functioning well. Maybe you're stressed because your body is constantly in a fight or flight mode. So even when you take in the food is not going to be properly digested. When it goes to the small intestines, it can't be absorbed because it's partially digested. So it's going to be set in the colon, and the colon cannot digest what has not been properly broken down. So it has to stay in the colon for quite some time compared to the usual time. You're going to get constipation in that regard. So if you're coming and all you want is colon hydrotherapy, it's true that we are going to do a cleansing and the colon will be able to rejuvenate. But then we also need to address the bigger factor, which is your neurological problem. It could be an autoimmune disease, it could be anything that is causing this. So this is where we're going to tell you, you know what, alongside the colon hydrotherapy, let's also do the homeopathic medication, which is wide, that it's going to be able to address even your immune system.
So this is what you refer to as holistic approach?
Definitely. It's a holistic approach to health, because it's not necessarily looking at the symptoms you're having. Someone having a constipation, someone having bloating, that is not the end of it all. That is not the end of it all. If we can stretch our mental attitude, there is one man who said that the great questions of the day are not going to be solved by great speeches, but by iron and blood. The great questions of today's world are not going to be solved by the very many tablets in the pharmacies. We need to sit down, we need to reset. We need to go back to the drawing board. People are managing diabetes, people are managing hypertension. But the person who is managing hypertension maybe needs a lymphatic drainage, you know.
Dr. Mutiaba, this brings me to another question. Maybe where's the difference between conventional medicine and the holistic approach?
A very good question. Now, when we look at conventional medicine in the general term, it's going to be addressing the symptoms. That is why you see many times when
Symptoms?
yes, when you go to the pharmacy and they are asking you, what is the problem? If you tell them headache, they are going to give you medicine for headache. No one is going to bother asking you, when did it start? How did it come? How has it been manifesting? Is it gradual or chronic? They are going to give you a headache relaxer. When you come to Rennaisance, for example, and you're coming in for homeopathic medication, we're going to take a journey in your health life. When did this headache start? Because someone is going to have a headache that is coming as a result of prolonged stress or suppressed depression, for example. Because, for example, if someone loses a loved one and then they are not attended to, they're going to have that stress inside. They are going to suppress it. They are going to look at all ways of calming it down. But then you are not releasing it out. You're just calming it down. Now, your body holding on to this is going to bring a cascade of very many effects. Last time we talked about the happy hormones, the neurotransmitters that are supposed to be released from your gut. If these are not released the right way, that means your body is not going to be functioning even to service the other parts of the body. Now, you will look at someone who is just having a low mood at the start. Eventually, they are going to start having brain fog. Their concentration spans are going to lower. At work, they will definitely not be functioning anymore. You tell someone, you know, we need this piece of work finished at this moment of time, they even forget. They don't even just slowly do it, but they forget completely. So it's not that maybe their mental capacity is degrading. No, they are having a derangement that is chronic. And this is where we are saying, let's address that. Let's not address their forgetfulness. Let's address what is causing their forgetfulness.
Let's not address the forgetting.
Yeah, because why is this person forgetting?
Yes.
It's not just, for example, very many of
There
us
must be a
today
cause.
are putting on specs.
Yes.
Very many of us.
Yes.
I'll talk to a more sensitive question or a subject. Very many of us today are putting on braces, and it's becoming swag. But then, have you asked yourself where the deformities are coming from? You know, because if you're having deformed jaws, if your gum is not able,
so are you telling me you can also say that?
Exactly, because right away from the start, how are you eating? And the eating is not necessarily how are you feeding. What are you chewing? You find someone buys gum and they chew it from morning to the time they go back to their bed. You're constantly keeping your jaws in action. When are they going to rest? You find that very many people today, throughout the whole session, they are holding their phones. They are scrolling morning to morning. And then in the long run, you start feeling numbness in your fingers. You ignore it. It graduates to your wrists. You ignore it. Before you know, the whole hand is starting to get numb. But then it came right away from how you were.
How you using your phone.
Exactly. So this is where we need to address the bigger question of the day. It's not about treating the numbness. In homeopathy, we have very many drugs that are going to deal with that numbness. Many drugs that are going to deal with your muscles. But then, for example, let's talk about the deity. The muscles work in conjunction with the neurons. We have what we call a neuromuscular junction in our body. For each and every muscle, there is an attachment to a neuron or to a nerve. Now, at this neuromuscular junction, there is a cascade of very many things happening there, both chemical and physiological. Now, if, for example, someone is not eating enough salt in their food, they are not going to be able they are not going to have enough sodium ions in the body. Now, when you reach at the neuromuscular junction, there is going to be an impairment. We have a neurotransmitter that is called acetylcholine. It is also going to be helping at the neuromuscular junction. When, for example, you are touching something, for you to be able to feel that texture, for you to be able to feel the temperature of the object you've touched on, there has to be impulses taken from your cells through the effectors, rather through the efferent, and then you be able to realize, oh, this is hot, and you take away your hand. In the long run, for example, to people who are having diabetes, they reach a point where their sensory organs, or actually their sensations, have reduced. They get wounds and they cannot even feel the pain. The wounds start getting septic, and sometimes they end up getting amputations because the sensory, the senses in that, or the sensory system in that part is no longer functioning. So now you see that you're treating diabetes, or you're managing diabetes, which is going to largely be looked at as a gut problem, because we know when you have diabetes, they're going to tell you, go off this, go off this, go off that, which is right. But then in the long run, you're going to come to realize that you're having very many complications arising from that. So when the body is not going to be able to address this, it is not going to make an alarm, but it will show you the effects. Now, we are saying, before even these effects come, for example, before you get the bloating, constipation is going to be there. Because a large amount of the gas in our colon is coming from the fermentation of the delayed stool. You get. Now, you come to realize someone has spent 2 to 3 days without going to the washroom. But because they still have their 6 packs there, it doesn't matter. I don't give a damn. In the long run, when they start getting the bloating, now they want to increase the frequency of the gymming. You're increasing the frequency of the gymming, you're hurting the already malnourished muscles, because the body is no longer absorbing the nutrients needed at the neuromuscular junction. So how are the muscles going to work?
If somebody asks you, why is wellness so important?
Now, like we said, that wellness is not merely absence of disease. Let us look at a problem like hypertension. When someone is hypertensive, they are not necessarily going to put out symptoms until their hypertension starts to give us secondary symptoms. This is when we start seeing you getting headaches. This is when we start seeing you getting problems with your breathing to some extent. This is when we start your kidneys starting to malfunction. Now, the hypertension, which was primary, is the one causing all these. When you go to the hospital, you're going to be managing the headache, you're going to be managing the nephropathy, and then you're not necessarily looking at the hypertension, which was the primary cause. At homeopathy, at Rennaisance Wellness Services, for example, in homeopathy, we are saying, if you're having kidney problem as a result of hypertension, let us first look at the hypertension. Because even this hypertension is not necessarily a disease. It is an adaptation of the body. For example, if you're maybe taking a lot of fabricated drinks, if maybe you're not having a proper diet, if you're not taking enough water, before you even look at the renal problems you're having, address your diet. Many times when we talk about a balanced diet, people think of, let me stop eating the junk, let me stop eating ABCD. But by a balanced diet, we mean your body needs the carbohydrates to synthesize energy. Your body needs the proteins to replenish your blood cells. Your body needs the vitamins that are actually having very many antioxidants. Your body needs the anti-inflammatories. You're not getting this from one food source. You get. So we are looking at balancing. But then a layman is not going to know how
actually,
to balance this.
Dr. Mutiaba, you should explain that so well. Because sometimes doctors tell us you don't have to mix food. You eat this and that. You don't have to do that. They say eat one type of food. Now for you, you're saying
yes. Now we misquote them and we present them as wrong. For example, if someone is eating matoke and rice, or maybe if they are eating beans and matoke, we are saying, okay, the beans have a little amount of proteins in them. So yes, we are going to be getting some proteins from in there. Why again get the beans and mix them with the beef? You get? Because
it's not necessary.
It's not necessarily so. Of course, it's not definite, by the way, because, for example, in infants, where you're going to realize we are going to tell you, make them Irish, mix it with some maybe silverfish, because we want a significant amount of nutrients in a small portion of food. What the doctors are saying is, don't get a kilogram of posho, 3 slices of this, this and this and this, put it all together, and then you eat it all at once. What they're actually saying is, if your diet today is going to be rich in carbohydrates, let it be rich in carbohydrates. The next day, don't eat the same carbohydrates you ate yesterday. Where did you put all that energy that you synthesized from the carbohydrates? Because there is nothing else you're getting from carbohydrates apart from the energy. And many of us today are living a sedentary life. You know, you wake up from your bed, call a Uber, sit in the car, come to work. There is no exercise, but you're eating carbohydrates morning to evening. Why? So that is why they are saying don't mix these foods. You know, let's have a routine. For example, if today I'm eating this, today I'm eating this, the next day I'm eating the other day I'm eating the other type of food. You get? Of course, this is going to differ. It's not generic, by the way. Let's also note that. As someone who is having, for example, kidney failure, may not necessarily eat the same foods like someone who is diabetic. For example, if someone is diabetic, it's very okay for you to go away from all foods that are necessarily going to increase your sugar rates. All foods, because diabetes means you're having excess sugars in the body. Yeah. Why do you need these other foods?
Thank you so much. Doctor, who needs wellness?
Now, bottom line is we all need to be well. We all need to be well. Therefore, all of us are candidates of the services offered at Rennaisance Wellness Services. But of course, there are going to be degrees, because some of us have, in one way or the other, tried, or some of us are not at the lethal end. But then, there are some of our friends that are already experiencing the problems.
The effects.
Yes. For the colon hydrotherapy, for example, if you know you're having any gastrointestinal related problems, gastrointestinal related problems come out from the mouth to the anal area. Very many people have used a lot of toothpaste in addressing bad odor in the mouth, but it's actually coming from your intestines. Every time you're having delayed if you're having malfunction in your digestion, you're having delayed digestion, you're definitely going to be having a bad odor, because what is delaying in the intestines is fermenting and then giving a reflux. You get? People who are having ulcers, people who are having constipation, people who are having bloating, and secondary problems like brain fog, low concentration spans, please come for colon hydrotherapy.
Thank you so much. Your last remarks.
Now, everyone needs Rennaisance. Everyone needs wellness. Wellness is not a destination. Wellness is a journey that we have to keep walking each and every day. At Rennaisance, we say, make time for wellness because it's worth it. Our contacts are 0757 75 44 70. You can WhatsApp us or call us, and we'll be definitely
Let's say it again
to help you. The contact is 0757 75 44 70.
Where you?
We are located on Matters Crescent in Ntinda, opposite UHMG complex.
Okay.
Yes, please.
Thank you so much. Abatulaba ibaduzungu na lugenze mudiba nange simena kumanya. Mweba kwanti mutambule na foda ko radio. Nze twa hamchibi badine Dr. Mutiaba. Muchibi ne Mutiaba olwaibe badi bakaweereza. Mubeere bulungi Katonda batukumire. wherever.
Eno ye Salam TV.